Hi friends, welcome back to my channel. My name is Aina and I am an oncology pharmacist. 1 in 2 people will get some type of cancer in their lifetime and 1 in 4 will die from the disease. Whenever we see on the news someone is diagnosed with cancer or dies from cancer, the overall reaction is always supportive, but there's a lot of worries out there. So since there's not that much general information about cancers out there on the internet, I thought today I would make a very basic overview of every type of cancer and I would rank them on a tier list. And here's how I'm going to rank them. I'm going to talk about every cancer's survival rate, how likely it is to get it, does the cancer cause a lot of pain and suffering and really impact quality of life, what kind of treatment options are available out there currently, and if the treatments are also very painful to go through. I mean, S tier would mean that this is a completely curable, no symptom disease. Even if I get it, it wouldn't affect my life. So none of the cancer would fit into this category. Getting cancer sucks. A tier I think would mean the cancer doesn't affect the quality of your life that much. It is mostly curable and the survival rate looks very good. And then all the way down to F tier, which would mean that cancer is not very well studied. We don't know a lot about it and there's not that much treatment options. And if the survival rate is also looking very grim. Disclaimer, this video does not replace any individualized medical advice. If you suspect or have been diagnosed with cancer, please talk to your doctor about your individual disease. Also, the statistics that I used are Canadian, so it might not apply to everyone around the world, but it's a good snapshot for other developed countries in the West. Breast cancer. So breast cancer is the most common type of cancer in women. Actually, men can get breast cancer as well, but it's less common. So what makes someone at higher risks of getting breast cancer, or what we call risk factors? Well, the older your age, the more likely it is to get breast cancer. Also, something interesting, not having children in your lifetime can put you at a higher risk of getting breast cancer. Oh, by the way, family history is definitely one of the biggest risk factors for all of these cancers. So I'm not going to talk about family history for every single type of cancer. But I would say breast cancer is one of the most well-studied and well-researched cancer out there just because it's so common and affects so many people. We overall have a pretty good understanding of what causes breast cancer, including hormone levels in your body, certain genes that are mutated, for example, the BRCA1 and BRCA2 gene mutation, which famously Angelina Jolie is known to have that mutation, and she went through a preventative surgery to remove both of her breasts, which we call preventable double mastectomy. And as for the symptoms of breast cancer, well, some people might not notice anything and then it's discovered that they have breast cancer on something called a mammogram, but other people might start to find a lump or soreness in one of their breasts. The good news is with breast cancer, it doesn't matter what stage it is, there are lots of treatment options. Of course, the first thing we would think about is whether or not we can perform surgery. We also have radiation therapy, we have good old-fashioned chemotherapy, and we have a new type of therapy, which is called targeted therapy. Unfortunately though, the side effects from most of these treatments are quite harsh and hair loss is quite common with breast cancer treatment. The survival rate for breast cancer is quite promising. 89% of breast cancer patients will live for at least 5 years, and this is what we call a 5-year survival rate. So I would say for breast cancer, I'm going to put it in a B tier. Even though it is very well studied and with lots of treatment options out there, for most people it is still a lot to go through. And unfortunately, we still have a lot of metastatic breast cancer patients where when we diagnose them, the cancer has already spread to other parts of the body. Lung cancer. We all know that cigarette smoking causes lung cancer, and actually up to 90% of lung cancer are associated with cigarette smoking. Even if you don't smoke but you live with a smoker, your risk of getting lung cancer is increased by 20 to 30% through secondhand smoking. As for the symptoms of lung cancer, some people have lung-related symptoms like coughing, coughing up blood, difficulty breathing, shortness of breath, but some people actually don't. And unfortunately, again, if people don't have symptoms, it's hard to catch this early. Lung cancer is known to spread to the bones and the brain. They could just get generalized symptoms such as back pain, they can get brain fogginess, memory issues, headaches. So treatment of lung cancer includes surgery where we would remove part of the lung. We can use radiation, we can definitely use chemotherapy, and there's a new class of drugs that basically teach your body's immune system how to fight the cancer which are called immune therapy. The 5-year survival rate for lung cancer is only 22%, which means only 22% of the people with lung cancer are still alive after 5 years, and unfortunately, about 30% of the people are already metastatic when they're diagnosed. I'm definitely putting lung cancer in D tier. We do know a lot about it, and there's some good treatment options out there that even can target certain genes, but because of the overall poor prognosis, I'm going to have to put this one in D tier. Colon cancer. Colon cancer is the cancer of the large intestine. It's more common after the age of 50 years old, and it's more common in men compared to women. But it's also increasing in younger people, and it's possibly due to obesity or having a lifestyle that doesn't move too much, which is what we call a sedentary lifestyle. The good thing with colon cancer is we know exactly how to catch and prevent it. There's a certain proof test that you can do called a FIT test, and also colonoscopy. The good thing about a colonoscopy is if they find anything while they're doing it, they can just snip it off right away. And a lot of times, these small lesions that are growing can turn cancerous in 5 to 10 years. Chadwick Boseman unfortunately died at the age of 43 from colon cancer. He was diagnosed with stage 3 colon cancer in 2016. He progressed to stage 4 in 2020 and also passed away in 2020 as well. Symptoms of colon cancer could be quite bad. You can get a lot of diarrhea or constipation, so there's a lot of pain and blockage feeling going on in the gut area. For treatment, we can obviously do surgery, radiation, there's chemotherapy, and there's targeted therapy as well. The side effects to these treatments are not super terrible, and hair loss is something that's uncommon in colon cancer treatment. The survival rate isn't that great. It's about 55% for a 5-year survival rate. So I'm going to put this one in C tier. Even though we have a good prevention program going on, it is still the second most cancer-related death out there. Prostate cancer. Prostate cancer is the most common cancer in men in America. Interesting fact, diet that is too rich in fat and red meat can lead to an increased risk in prostate cancer. Again, this is a type of cancer where it's easily preventable. All men over the age of 50 are recommended to do this. It's called a digital rectal exam, which is what we call a finger test. Literally, the doctor puts his or her fingers into the bum and feels the size and the density of the prostate. And just with that simple test, prostate cancer is really preventable. It's also a cancer that grows really slowly, which is a great thing. And symptoms are usually pretty mild if it's caught early. It's very similar to when older men experience difficulty peeing. As for treatment, surgery to remove the prostate is definitely something the doctors would recommend. Sometimes they would recommend removal of the testicles as well, because testosterones are what's making the prostate grow. So we want no levels of testosterone in the body, and by removing the testicles, you effectively remove testosterone levels. Of course, not everyone might want that, so there's actually chemotherapy as well to achieve the same effect. The survival rate for prostate cancer is really good. It's about 91% overall for a 5-year survival rate, and close to 100% 5-year survival rate for early prostate cancer, which is amazing. Which is why a lot of people that we know and love, like Robert De Niro, Ian McKellen, they've all been diagnosed with prostate cancer, but they're still alive. So I think I might put this cancer in A tier. It is definitely one of the better cancers to have, and I know a lot of healthy older gentlemen over the age of 80s or 90 years old that are still living their life even though they have a diagnosis of prostate cancer. Brain cancer. One of the risk factors for brain cancer is high levels of radiation. And there are certain jobs that actually expose you to higher levels of radiation compared to normal. These can be medical offices, dental offices, or hospital areas where X-ray and CT scans are done. Or if you work in the nuclear industry where nuclear weapons are made, or you work in the nuclear power plant, or if you're a pilot or flight attendant that's flying at high altitudes. What sucks is there is no prevention of brain cancer, and about 15% of all brain cancer happen in young adults. The symptoms are generally related to the brain, such as nausea, headache, difficulty speaking, or even changes in personality. I've been following this YouTuber called Erin that's been unfortunately diagnosed with brain tumor, and I'll put her channel link down below if you're interested in her journey. The treatment for brain cancer really sucks. There's not too much we can do. Obviously, surgery to remove the tumor. Chemotherapy has very limited options, and radiation, but you typically can only receive radiation once in your lifetime, especially if it's to the brain. And radiation actually increases your risk for other cancers down the road. And for survival rate, it isn't looking that good. It's only about 22% 5-year survival rate, which means only 22% of the people are still alive 5 years after their brain cancer diagnosis. And what's worse is there is not a lot of research in brain cancer. Perhaps there's just not enough money in the field, so I'm definitely putting this one in F tier. Pancreatic cancer. Pancreatic cancer is a cancer of the pancreas. We know that tobacco smoking, obesity, and diabetes can increase someone's risk of having pancreatic cancer, but there's really no screening method to catch it early, which really sucks. Treatment options include surgery. There's actually not too much good chemotherapy or new targeted or immune therapy for pancreatic cancer, and Steve Jobs died from pancreatic cancer. For 9 months after his diagnosis, he refused medical treatment but did alternative therapy instead. He tried vegan diet, acupuncture, even herbal stuff before he finally agreed to surgery. And after surgery, he refused any radiation or chemotherapy. And the survival rate for pancreatic cancer is really bad. It's only about 10% for a 5-year survival rate, which means only 10% of the people are still alive 5 years after their pancreatic cancer diagnosis. So this is also definitely going in the F tier as well. Skin cancer. Skin cancer is the most common cancer worldwide, and we know exactly what increases the risk for skin cancer. It's the sun, and the main hazard is periodic exposure to intense sunlight, which is basically when most people go on vacation. We also know that fair-skinned people that don't tan easily but burn easily have an increased risk. It's entirely possible to catch skin cancer when it's early, and there's a very easy guide that you can follow. It's called ABCDE. So look at any moles on your skin and you will look for A, asymmetry. B for border. Is the border regular or irregular? A non-cancerous mole's border should be regular. C for color. For a mole that's cancerous, there could be 2 or more different colors on one mole. D is for diameter. If a diameter is larger than 6 millimeters, then it's suspicious for cancer. And E, if it's evolving. And if you notice a mole with any of the ABCDEs, it's definitely a good idea to get that checked out by a doctor. Treatment, if it's early stage, just involves surgery. Take that mole out and you're done with. For later stages, we can do radiation and immune therapy or targeted therapy. Chemotherapy actually doesn't play a big role in the treatment of skin cancer. Overall, skin cancer is completely curable if it's caught early. For example, one of the biggest streamers on Twitch, Ninja, recently found out that he had skin cancer. But the good news is it looks like he found out early and it was completely removed, and now he is cancer-free. Overall, the 5-year survival rate for skin cancer is 89%, which is really good. So with all that said, I'm going to put this one in B tier because I think this is a cancer that majority of the time is preventable, but if it does become metastatic, it can spread quite fast. Liver cancer. The risk factors for liver cancer can be hepatitis B or C infections, or if there's cirrhosis of the liver, which means scar tissue on the liver. For treatment, there is surgery or transplant options, but usually only for early stages. But something really cool that's used in liver cancer is called nuclear medicine. Basically, we have invented a way to deliver radioactive isotopes directly to the cancer cells, so they would only kill the cancer cells and spare your normal body cells. But what's annoying is that the liver is the main site to metabolize a lot of the drugs. So when the liver function is affected in liver cancer, it is hard to find a lot of good drugs that can treat this condition. So overall, liver cancer really isn't that great. The 5-year survival rate is only 22%, and unfortunately, it's usually found out at a later stage. This one would have to go into F tier again. Testicular cancer. Testicular cancer is actually the most common solid tumor in men between the age of 15 and 39 years old. There's not too much we can do to prevent testicular cancer, but it's always a good idea to self-monitor for any changes or abnormalities. If it's caught during early stages, usually it's swelling. Some people might not even have pain, and in most cases, it's just one-sided. The treatment for this is pretty intensive. Surgical removal of the affected testes is pretty standard. Plus, we would do radiation on that area. Does that mean you will never have kids again? Absolutely not. Your doctor will definitely talk about sperm banking before sending you to do all the treatments, and during radiation, they would actually shield the other testicle. I know patients who are testicular cancer survivors and they have kids, which is amazing. A few years ago, I saw a YouTuber share his testicular cancer journey, and now he is cancer-free, which is amazing, and I'll put his channel link down below. And as for chemotherapy, it is quite intensive. A lot of the other chemotherapies are usually given every 2 weeks or every 3 weeks, so you get a pretty nice long break between each cycle. But for testicular cancer, it's given every day for 5 days straight. But fortunately, testicular cancer has a very good prognosis, with a 97% 5-year survival rate. So overall, I think I'm going to put this one in B tier. Most of the time, it does have good outcome, just quite tough to get through all the treatments that involve surgery, radiation, and chemotherapy. Stomach cancer. Stomach cancer is actually disproportionately higher in Korea and Japan. We're not 100% sure why, but I think the guesses are because they eat a lot of fermented food. Stomach cancer can give someone a lot of bad symptoms. They might not have appetite, they might have a lot of stomach pain, nausea, vomiting, and the treatment options are not that great. You could do surgery, radiation, and chemotherapy, but there's not that many choices in the chemotherapy area. Overall, the 5-year survival rate is quite low as well. It's only 29%. So I'm going to put this one in F tier. Ovarian cancer. Again, like breast cancer, not having kids actually increases a woman's chance of getting ovarian cancer. And what sucks about ovarian cancer is there is no screening. So it's typically discovered at a later stage. So at that time, symptoms can be really bad. There can be a lot of bleeding, there's pain and swelling of the gut area. Treatment obviously involves surgery if that's possible. Chemotherapy is out there, but a lot of the diseases can become actually resistant to chemotherapy. Overall, I've seen ovarian cancer progress quite quickly and become resistant to treatment. The 5-year survival rate is about 45%, and the symptoms are quite horrible, so I'm going to put this one in F tier as well. Cervical cancer. Cervical cancer is the cancer of the cervix, which is the small opening of the uterus. The most common risk factor for cervical cancer is actually a sexually transmitted disease. It's called HPV, which is a group of viruses that are basically carcinogens. It's really good now though that we have a vaccine for it called Gardasil 9, and it's recommended for both men and women. And I basically recommend it to all patients as long as they meet the eligibility criteria, and I think it's safe for them. I mean, a vaccine to prevent cancer, that's like the best thing out there right now. We also have a pretty good screening program for cervical cancer called the PAP test. The overall 5-year survival rate is about 74%. Cervical cancer rates have dropped dramatically in recent years, which is definitely good news. I'm going to put this one in C tier because of the good prevention program that we have, but once you get it, it's still a lot to go through for treatment, and there isn't a lot for choice for chemotherapy. Leukemia. Leukemia is a little bit harder to talk about because there are many different kinds of leukemia. There's basically the more acute or aggressive type, and there's the more slower and chronic type. It's sad though that in young people, the more common type of leukemia is the acute and aggressive one, and in older people, the more common type is the chronic and slower one. The symptoms for leukemia are not very specific. People generally just start to feel really tired. It's like they got a flu. They can have fever, weight loss. But something that's a little bit more specific to leukemia is easily bruising or bleeding through the gums. Kaide, the streamer that I watch sometimes, has a diagnosis of AML, which is acute myeloid leukemia, and it's the type of the acute and aggressive one that I said was more common in young people. I think in her stream, she talked about she first noticed her symptoms being feeling really tired and had a lot of bruises on her body. For treatment, we definitely need to use chemotherapy and try to cure the disease once and for all. And we can even consider stem cell transplant in some cases. And stem cells are basically like baby cells, and they have the ability to grow into any type of the cell that your body needs. Sounds pretty wonderful, right? Stem cells can actually give someone the chance to prevent the leukemia from coming back. But it can be also risky as well because it can give some people a lot of side effects or complications. When I first heard the idea of stem cell transplant, I thought it's this whole big procedure that involves maybe opening a donor's spine and somehow harvest the stem cells and then somehow plant that into the receiver's spine for it to grow there. But it's actually a fairly elegant and simple procedure. You could just collect the stem cells from the donor's blood. Well, typically there's not a lot of stem cells in the blood, but you can give this drug to the donor, and this drug makes the stem cell grow a lot faster and move from the bone marrow into the blood a lot faster. And then it can just be given through IV into the receiver's blood. The whole thing takes like 30 minutes to an hour. And then once in the new body, the stem cells can actually recognize what's needed in the body, and it will grow into that type of cell. Overall, it's hard to talk about the survival rate because there are different types of leukemia, and I would say it's about 50% or less 5-year survival rate. So I'm going to put this one in C tier. Lymphoma. Lymphoma is another type of cancer that it's really hard to talk about because there are just so many types. I've already made a whole video about Hank Green's Hodgkin's lymphoma, so I'm going to link that down below and here as well. So I'm going to go over this really quickly in this video. Basically, lymphoma can be divided into two big categories: Hodgkin's lymphoma and non-Hodgkin's lymphoma. The symptoms are really different depending on what type you have, and the treatment is very different as well. The survival rate is quite different from these two different types. For Hodgkin's lymphoma, the 5-year survival rate is about 85%, but for non-Hodgkin's lymphoma, it's a little bit difficult to tally because within non-Hodgkin's lymphoma, there's maybe another 10 subtypes of different kinds of lymphoma, but I would say overall it's about 60 to 70%. Obviously, some of the survival rates are worse than others. So this one's gonna be a little bit hard to rate because Hodgkin's lymphoma, pretty good prognosis, non-Hodgkin's, a lot worse. Maybe I'll just put this one in a C tier. Sarcoma. Sarcoma is a really rare type of cancer that starts in the tissue that supports and connects the organs in your body. Those are tissues that we call connective tissue. The most common forms of sarcoma can start developing in the bones, fat, muscle, or blood vessel. The symptoms can be really non-specific because they really can start anywhere. Let's say if it starts in your arms or legs, then you can have pain and swelling there. If it starts in the gut, some people can have diarrhea or blood in the poop. Technoblade, the really beloved YouTuber, passed away from sarcoma, and I believe he started noticing symptoms in his arms. But I'm not sure if he went into depth about what exact sarcoma type he had. Unfortunately, because this group of cancer is so rare, treatment options are not that widely available. There are some chemotherapies and targeted therapies that can help with sarcoma, but there's just not that many great options. Overall, the 5-year survival rate really depends on what specific type of sarcoma you have, but generally speaking, it's about a 60% 5-year survival rate. So I'm going to have to put this one in F tier just because of how rare it is and so little things that we can do to help with this. So that was a really quick overview of some of the more common types of cancer. I didn't even get a chance to include everything. There's still kidney cancer, bladder cancer, eye cancer, and a bunch of others that I haven't had the chance to talk about. So if you're still interested in a sequel to this video, please let me know in the comments. Hope you found this video educational and interesting. If you liked it, please give it a thumbs up and subscribe for more contents like this, and I'll see you in the next one. Bye! Well, some people don't know. Oh my god, that really scared me. Someone's cleaning the window out there and they threw down 2 ropes against my window and I thought someone was gonna break in. Anyway.